All right. Okay. So I'll start. So welcome. Let's. Okay. So I'd like to start by just acknowledging the traditional owners of the land on which we meet today, and the lands on which everyone is on today, and their elders past and present. And this image here is of one of the two paintings from Colin Jones, an Indigenous artist and Indigenous academic, which hung in the QRME offices in Toowoomba. And if any of you do join us on the program, I'd encourage you to come into our office when we join together at Hub Days and see this painting. And it is interactive, and we can interact with it and touch it and ask about the history of that. Colin is one of our presenters, and he presents on First Nations history, and will be available in the program. So as I said, I'm Dr. Brendan Carrigan. I am the third year medical lead for the Griffith Rural Long Look program. And I'm also a senior medical officer out at Dalby. I do colposcopy at Toowoomba Hospital along with leading the program. So I'm having a bit of trouble with my presentation. Just stop and I'll see if I can load it again. So the Long Look program is a little bit different to other programs that we have in Griffith, and you're probably used to a traditional block program. And as such, the Long Look program probably caters for a different student. It is a lot more, has a lot more autonomy in the program. It has a bit more flexibility, and you do need to be flexible in terms of your learning, in that you will be learning the entire curriculum over the entire year rather than in discrete blocks. It does avail you to be in a rural community, which is much more community connected and community driven. And you need to be able to live in a community of students and health professionals that is isolated from the main program down in the Gold Coast. And you need to enjoy a more hands-on and interactive program where actually doing and acting like an intern more than being in the back seat and watching in the background. So on the Long Look program, we aim to give you a really positive medical experience. Our program is more immersive, and you'll be working as part of the clinical team, and we really value the input that our students put into our medical teams in each of our sites out in the rural areas. You are a valued member of the team who contributes to the clinical care of patients in their process. You are exposed to working in practice and learning how really to be an intern, which is what we want you to be at the end of your medical program, through working like a program. And we aim to give you support to pass your assessments and become a successful general doctor at the end of the program. So the long look program is a bit different in that it's a longitudinal integrated clerkship is the fancy name for the type of program that we run. And instead of learning in the discrete blocks that you do down on the Gold Coast program, we learn all of that curriculum across the 42 weeks of the year. And you'll be doing a bit of each of those blocks in every week of the program. So instead of going and doing a week on the medical ward, or 7 weeks on the medical ward, you might do a day on the medical ward. The next day you might spend a morning in surgery. In the afternoon you might be with the mental health team doing mental health assessments. So a really integrated, comprehensive program across the whole year. So that's for most of our sites. The Toowoomba program's a little bit different. So we do have 4 students in Toowoomba, and the Toowoomba program works as a blended program with general practice placement, where you spend most of your time in a hub general practice with some in-look from general practice to specialists within the Toowoomba region in general medicine, geriatrics and neurology, surgery, obstetrics, and some specialist, some general practice with special interest in pediatrics in the Toowoomba program. So we expect that you, within your 42 weeks, you'd be doing 35 hours a week of hospital attendance, and that will be, like I said, a mix of all of the different blocks. We do provide some in-look into areas that we know that need some extra support, and you do get a week with ROC, which is radiation oncology in Toowoomba, and we organise a 1-week placement with the acute mental health service in Toowoomba to give you access to some complex acute mental health through that week. You still attend all of the same requirements on the Gold Coast for climbs, and about every block we all meet in Toowoomba for a 2-day, a 2 to 3 day clinically practice-based hub program where we meet together and run through the clinical skills that we need to be successful in the program. And we also, during the beginning of the year, run some sessions on MCQ technique, leading into the middle year exam, and then towards the end of the program we run mock OSCEs along with that to prepare for the end of year OSCE exams. Examinations, at the moment we are negotiating running examinations in Toowoomba centrally to the Darling Downs for both OSCEs and MCQ. We did run the mid-year MCQ from here to reduce the travel on the program back to the Gold Coast. Additional opportunities available through the program. So we do encourage students to be involved in clinical audits, and at the beginning, through the whole program, we run through a module on research of developing a number of student-driven research projects of interest in rural areas, and support student groups to perform that research, and then an opportunity to present the outcomes of that research at the end of the year to the Darling Downs Health Care Service executive and other stakeholders in the region. A number of those projects have actually gone on to be presented at national conferences such as Rural Medicine Australia and some of the education conferences. We also had some of our students present at WONCA, so the World conference on rural generalism. So great opportunities there in research. We also are very community driven, and so we allow time within our program for students to be involved in community projects and encourage that. There's been a number of different projects that have been driven by students. First aid projects in Kingaroy. The Stanthorpe students a few years back did a project of increasing education on CPR in the community. We've had students involved in soup kitchens and homeless health projects as well. So vast variety. And we also have an optional certificate of rural health, which has a few extra requirements, although most of them all of those can be achieved within the placement that you have in each of our sites. And at the end of that, through doing a little bit of extra assessment and curriculum, you end up with a certificate of rural health at the end of the program. Obviously, being in a rural area, I think, has some social benefits. It's a great place to live. It's wide open, fresh air. There's lots of recreational activities around each of our sites, bushwalking, going out, boating on dams, water skiing. We have there's a real community of practice in each of our rural sites, and you get direct access to your consultants, other healthcare professionals, and we often meet outside of the program in social events. Although there's a real community of practice with other students that are available that attend those sites, such as dental students, physio students, etc. So form a real close-knit community. You also become a real part of each rural community and integrated part, and people know who you are and actually value your contribution to the healthcare of that community. Accommodation travel, so you are expected to travel to the rural site, so it is difficult if you don't have a car and a driver's license, although we can work around that. So you're expected to get there and drive to and from the hub days once a month. We do provide assistance in terms of the cost for travel to and from hub days, although it is limited to a certain number of cars from each site. You do get subsidised accommodation, so each of our sites have either on-site or close to site accommodation, and have reduced and subsidised rent available for those rooms, and that is at $50 a week currently. So, and if you are required to travel back to the Gold Coast, we do provide accommodation for those for the climbs or the rock or AMHU in-look weeks that we provide. So our long look sites, we have a number of sites across the Darling Downs and also one within Metro South, so Gympie, Kingaroy, Dalby, Warwick, Stanthorpe and Beaudesert. And we also, as I said, take 4 students in Toowoomba. So running through each of our sites, Dalby, so Dalby's a lovely hospital. I work at Dalby currently. They birth about 169 babies. There's about 4,000 hospital admissions a year. Accommodation is in one of 2 houses. So there's a New Street house, which is about 5 minutes from the hospital, and there is also another house that is next to the hospital. We will take 3 third-year students there next year. Kingaroy. So I worked in Kingaroy for 7 years. So the busy one of the so it is the largest non-specialist bedding unit in Queensland, if not Australia. High acuity hospital, has about 7,000 admissions a year and lots of throughput through the emergency department. The accommodation in Kingaroy is on site on the hospital grounds and will be right next door to the brand new hospital that is currently being built. It is about 2 hours from Toowoomba and 3 hours from Brisbane. They plan to take 5 third years next year. Warwick. So Warwick is the busiest emergency department of any of the sites that we have. Has a high throughput of obstetrics as well, of about around 150 to 170 births a year. Once again, the accommodation at Warwick is on site. In a Griffith student accommodation building. It's about an hour and 15 minutes from Toowoomba and about 2 hours from Brisbane, and they plan to take 5 students, third year students, for next year. Stanthorpe. So Stanthorpe, a smaller hospital, and a smaller amount of presentations there, but definitely a great group of educators and in a great location, being Queensland's premier wine region. So on-site accommodation in the Griffith Accommodation building, we have, it's about 2 hours from Toowoomba and 2.5 hours from Brisbane City, and they plan to take 3 third years next year. Beaudesert. So Beaudesert's within Metro South, the closest of our sites to the Gold Coast. Births about 200 babies a year, has about 15,000 emergency presentations there, in an off-site accommodation. However, it is flexible enough that it can be travelled from a number of locations around Beaudesert. It's 2 hours, 2.5 hours from Toowoomba, but only about an hour from the Gold Coast and Brisbane. And they plan to take 2 third years for next year. Toowoomba program, and like I said, was a little bit different. So based in Platinum Health Group in Goulbury, which is the Aboriginal Medical Service, as your hub general practices, seeing the curriculum with in-look into St Vincent's and St Andrews Hospital for specialist placement. We do have 2 accommodation units now in Toowoomba at Jelco, and also there is another one that we have just purchased. It's about 2.5 hours from Brisbane and is central to the hub location, and they will take 4 third years for next year. And then Gympie. So Gympie is in the Sunshine Coast Hospital and Health Service, and it is our furthest site. However, it is a high acuity hospital and is the only hospital that has on-site specialists in our rural sites. It is about 2 hours from Brisbane, and it's probably about 3 hours from Toowoomba. They plan to take 4 third years for next year. And so that's all of our sites and a brief introduction to the Long Look program. If you want any more information, Anne or myself would be happy to be contacted, and you can get more information on our website that's available there. But I'm happy to take a few quick questions if anyone has any before we go into the breakout rooms. I'll just update the emergency presentations for Gympie. There's obviously a typo in there, and they have about 30,000 emergency presentations.
Sorry, Brendan. Thank you for that. That was great. My name is Julia Rose. I'm one of the second years. I was just wondering,
Yep.
in regards to, you said 2 days a month, this long look students, they go to Toowoomba. Are those days
Mhm.
back to back? And is there
Yes.
accommodation there if it is back to back?
The both answers to those questions is yes. So both 2 days a month, back to back program. We provide accommodation while you're in Toowoomba, and there is time built into the program for travel as well. So yeah, we ensure that we don't just leave you out in the on the streets in Toowoomba.
Awesome. Thank you. I appreciate that.
No problems. Are there any other questions from the students before we organise the breakout rooms?
Hi there, Brendan. This is Tansy. I'm a second year too at the Sunshine Coast, actually.
Yeah.
And I was just wondering, I'm not sure if you're the person to ask this question of, but how the selection process works and like how we go about preferencing places, and I guess because with a lot of people living up here are interested in trying to go to Gympie, but they're also thinking, well, if I don't get Gympie, does that mean I could get one of the other rural sites? And so that's a much bigger change, especially if people have families and things already in the area. So
yeah. So I'm unsure of the specifics. Sorry.
Yeah, it might be a Griffith question.
Yeah, my understanding is that they'll open an online preferencing portal. How the preferencing and how they work out where you get allocated is a bit of a mystery. My understanding is that you'll be able to preference the programs separately, but we'll have to wait for guidance from Griffith. Yeah.
Okay, thanks, Brendan.
But I'll try and get back to you on that. If you send me an email,
okay.
I can definitely find an answer. Okay.
Great, thank you.
Hi, Brendan. I'm Izzy.
Hello.
I'm second year as well, and I'm thinking about possibly doing Toowoomba, but I understand that at the moment, due to COVID, they're pretty much solely at the GP almost. Or I was just wondering if next year you foresee that still being the case, where they're spending majority of their time in a general practice. Thanks.
So hard to foresee the future and what will happen with the current pandemic. So for recently, we have been limited, and that's not only experience in Toowoomba, I suppose, in terms of look into hospitals. We have restarted a number of those rotations into hospitals now, and they have opened up, and we definitely have our Toowoomba students who are going into obstetrics and with some of the physicians for neurology, geriatrics, etc., into the programs as of while there are some happening now and definitely as of August. So it is opening up. Can I say what would happen going forward? No, without knowing what will happen with the pandemic and the numbers. However, that is a risk with all of the programs, I suppose, and that's not unique to us in that on the coast, some third years have had restrictions in terms of completing rotations as well.
Yeah, okay. Thank you.
Yeah, I hope we don't have those restrictions next year.
Yeah. Same.
Yeah.
Hi, I'm Dushan. I'm another second year. I also was thinking of going to Toowoomba. I was just wondering, what would the breakdown for the GP clinic, like how many days would you spend, say, in the GP clinic versus then going into like the hospitals? So just having a general idea. It was normal, like under a normal circumstance.
So, Anne, are you online, and can you give a breakdown on the roster? Are there any, so before I answer that, Dushan, are there any sort of general questions that aren't site specific at all? No. Okay. Anne, it might be an idea if we split. Do we have the ability to split into the breakout rooms? If you can organise that, and then we can answer the Toowoomba specific questions, I suppose, in the Toowoomba breakout room. Does that work?
Yep. So in the meeting chat for this meeting, there's links for each site. And if everyone goes into that and then you go into the meet now, you can meet with the people for that section. So you'll see in the chat there's a link that will take you to each site page. So
I can see Warwick and Gympie and.
Yep. So below Warwick, there should be Stanthorpe, Kingaroy, and Dalby.
Oh, in the same.
Oh, gotcha.
In the same.
Yep.
So if you click on that, that'll take you into a chat, and then you go meet now, and that will take you to your breakout.
And we can keep Toowoomba here.
So
I don't think there's a
Toowoomba will stay here.
Yeah.
Cool.
Awesome.
So we'll give a couple of minutes, and then I'll answer your question on Toowoomba specifically.
Thank you.
See you.
Sorry, I don't know if this is just me, but when I press on the link, I can't join the group.
I'm having a bit of trouble too. When I go to the chat, it says I'm not a member of the chat, so I can't see any messages. But
Okay. I changed. Is everyone having that problem?
We are in Stanthorpe. It says request sent, but we don't go any further.
Request sent. Right.
So while Anne tries to figure that out, I might answer the Toowoomba question, and so I'll just rehash. So the question was, how many days do you spend in the general practice versus in specialty placement? Was that correct?
Yep, that was a question.
Yeah. So it's so difficult because as someone has already expressed previously, the program has had some shake-up, obviously, because of COVID. But in general, looking across the roster, it's about 1 or 2 days in general practice, and then we try to get your look into those specialty placements. And it really depends. So some weeks will be different to others in terms of what's available and what sessions you have in the week, and that may differ from week to week. So we have in-look into obstetrics. So there are 2 obstetrics groups that take students traditionally. There is the Queensland Specialists group, who have haematology and general physician, take students for sessions. Dr. Kleinschmidt and the geriatrics group up here take students on ward rounds, and that's available most days of the week. We have a general practitioner who visits the local mental health hospital and will take students on Thursdays. We have one of the surgeons who does a lot of bariatric surgery. We'll take students at St Andrew's Hospital, and I think that is, and then we have a general practitioner who who only sees pediatricians, pediatrics, effectively a pediatrician seeing complex pediatrics, and you'll place through that person a doctor of tours to get a lot of pediatrics time as well. So lots of opportunity there. So let it be a day or 2 days of general practice, I would think.
That was great. Yeah, that was perfect. Thank you for that.
Sorry, I can't seem to change the preferences for this to allow people outside of the group to see it, to go into the breakout sessions. So we might have to do it just within this session.
Okay, that's all right.
Sorry.
That's okay. So the breakout sessions were for specific questions about each of the sites. So I might be, are there any other questions specific for Toowoomba? So we might start with questions for Kingaroy.
I might just have to go and tell Jill.
Okay.
No, I'm here. All good.
Oh, you're there. Okay.
Okay. I think Deb, you're online from Gympie. I know Jess is online from Dolby. So are there any questions from Dolby for Dolby?
Looks like we're going to the Bahamas.
Sorry?
Looks like we're going to the Bahamas next year.
So are there any other questions for any of the sites? That's probably the easiest way rather than going through. We're all online.
Yes, I did have some questions. Just in regards to Beaudesert.
Yep.
So you said that in the first slide that it's 35 hours a week. Is it possible to have more flexibility in regards to like doing longer days or shorter days over more of the week, or longer days over a shorter amount of time? Or is it like a set, what sort of schedule is it like?
So Beaudesert, I don't know if Matt's on or anyone from Beaudesert is online at the moment. But I can take that question. Yep. So Beaudesert tends to be they run a real self-rostering program. So there are available sessions, and the students last time that I talked to Matt were able to choose which sessions they went to on that schedule.
Yeah.
Rural medicine runs on a 7-day program, and at each of the sites, it depends where you are, but in some of the you can do from morning to evening shifts. So you could roster yourself for a block, I suppose, and have some flexibility into that. But the Griffith program does expect that you achieve that at least 35 hours a week on average over the block, if you know what I mean. So there is, I would say, in Beaudesert there'll be some flexibility in terms of your rostering and program, but I would doubt you'd be able to just do like your entire block in 10 days straight, for example. You'd be expected to be there each week.
Of course, thank you. No, I was just confirming, just because some students are tutors and they just wanted to know for certain days they might have to be back at Griffith for tutoring, if they could kind of work around those sort of things.
So in the sites that I've been at before, definitely we can work, say if there was a day, and we've had students who've had jobs in the hospital, like they've been physiotherapists, for example, and working around that we've been able to work around those days or so within the flexibility of the program. Yeah.
Wonderful. And then, sorry, my second question as well is for Beaudesert again. Because living on the Gold Coast, because it is still quite, it's only an hour and a bit drive each way, each day. Is that something that is still okay? Like, it's not something that's kind of shunned upon? Would you prefer the students to live out there, or is commuting back, maybe staying there a couple of nights a week, is that something that is acceptable?
Look, we on a rural program, it's preferable for people to live in the community. That said, Beaudesert, traditionally students have lived outside of Beaudesert, and the majority of the staff live outside of Beaudesert. And so that it's not something that we would shun a student for doing, and that's acceptable. You just have to be able to meet the requirements of the roster and the program in that location. The only thing to say is that if things were to change with the pandemic declarations, that may make things difficult, but I would hope that those sort of things would be more clearer towards the beginning of the year. Okay, but that's like everywhere. So in summary, yeah, you can do that. We would prefer that you lived in community, but it's an option available to you in that location.
Wonderful. Thank you very much, Brendan. I appreciate it.
No worries.
Brendan, I just have a general question. Sorry.
Sorry?
That's all right.
You go. General question?
It was more about the third and fourth year, like whether it's possible to go to 2 different sites in each year or to apply to, and like whether having done it in third year affects your chances of getting into the program in fourth year.
So definitely possible to do 2 different sites across third and fourth year. And look, most of the students who continue on probably go to a second site. I don't know if we've had a student other than in Toowoomba continue in the same site across two years. We prefer, so for our numbers, it's better if different students do third and fourth year. There's nothing in the preferencing system though that reduces your chance of getting on to fourth year if you've done it on third year. And to be honest, we prefer that to happen because we know that students who do that are more likely then to continue on in rural practice. And really that's from our point of view, that's what we want with the Long Walk program, is to give students an exposure to rural health, and you'll all love it, and then you come back and be rural doctors. And so students who do third and fourth year are more likely then to continue on in regional and rural practice, regardless if it's general practice or specialty practice. So we would encourage students to be on both for third and fourth year.
Okay, thank you.
No problems. Any other questions?
Hi, I'm Katie. Yeah, I have a general question about the numbers of students at each site. So the ones that you mentioned earlier, are they the confirmed places for next year, or are they subject to change?
That's, as far as I know, that is the confirmed numbers.
Okay, great. Thanks, Brendan.
No problems.
Brendan, it's Coralie here. Do you mind if I say something?
Of course. Go ahead.
I just wanted to point out that that we've been very COVID proactive in QRME, and that has seen most of, if not all of our students continue on in clinical practice when other places more centrally may not have.
Thank you, Coralie. And yes, Coralie is right that most of our rural, well, all of our rural sites continued to allow access for our students during the pandemic declarations, and there was no restrictions to practice. Are there any other questions from the student site specific questions?
This is Sarah, also a second year. I was just wondering if you could tell us a bit more about the Certificate of Rural Health, please.
Okay, any specifics that you're looking for?
Just what does it involve? What, like, is it a graduate certificate?
Yep. So it's not a formal, it doesn't sit on the formal, the formal qualifications matrix, I suppose. So it's off, you know, so it's not a grad cert or a grad diploma, it's just a certificate of rural health that we issue as a private organisation. The requirements, so the requirements are really lots of things that we encourage you to do anyway within the program. So you're required to have a portfolio of patients in obstetrics and outside of the pandemic in some nursing home patients, where you follow those patients across the year and their journey within their access to healthcare. We encourage you to think about the differences of rural health in your formal assessment presentation, so your Oscars, and look, we do that anyway within when we do that case-based teaching within the program, but formally thinking about that and documenting it in your Oscars. We ask that you do a reflection or a video journal about your year and the positive and negative experiences that you may have had in rural health. We ask that you that you do engage yourself in the research projects that we have. We ask that you attend the farm day that we run, and then I've just had a mind blank. So yeah, that's the requirements of the rural health certificate. And we ask that you involve yourself in a teaching event and a community project. So those are the other two requirements off the top of my head. So all things, the rural health certificate is a formalization of a lot of the things that we encourage you to do within the rural program anyway, and we afford you access to do anyway as part of that. And it's just about formally documenting that and then collating it with a formal reflection of the year.
Wonderful, thank you.
Not a problem.
And is that open to all students?
So it's open to anyone on the rural program. Yep.
Thank you.
Not a problem.
Hi, Brennan. I had a question about the research opportunities in Year 3 and 4 with QRME.
Yep.
How does that operate throughout the year? And is there any differences amongst the sites on what kind of research opportunities there are or how it's operated throughout it?
Yeah. So we've changed the way that we deliver research projects this year, and we really try to take you through the entire process from developing projects through to ethics application, to data collection, to analysis, and then to presentation. So we start at the beginning of the year with a session on, hey, what are you guys interested in? What are some really interesting topics across each of the blocks that we can develop into a student-led project? So we might provide some guidance on what some interesting topics may be, but definitely if students have a topic of interest about rural health and the differences or access or presentations that they want to present, then we will support the development of that project. So we get student-generated ideas. We then guide you through the process of going through ethics application. We guide you through data collection and think about what sort of data you need, and then analysis of that data, and then finally presenting that to the DDHHS, executive and other stakeholders available. So that's sort of the whole process. We used to provide the projects up front and just say, hey, these are the projects that we're going to do. But we thought we'd round that out this year and start with getting some ideas generated from students and going through that whole process.
That sounds pretty good. Is that are you still going to follow through with that next year, do you think?
Yeah, so that's the plan for next year, would be the same plan for research.
Awesome. And it would be the equal opportunity no matter what site you'd be at, I'd imagine? Or is there any restrictions?
No, so all of the sites participate in research, and we try to develop research projects that aren't site specific. They're generalised, and it depends. Everyone has an equal opportunity to be on each of the projects, but obviously we try to encourage an equal split across the number of projects that we run. So we have sort of 5 or 6 that up to 5 or 6 that run.
Awesome, thank you.
No problems.
Hey Brendan, I have another question. It's about the connection between like being in that long walk program and then internships, like post 4th year. Like,
yep.
Does it help you to, I guess, get access to internships in rural areas?
So you're talking about, does it increase your chance of being on, say, a Toowoomba or a Mackay program as opposed to getting stuck at the Royal? Is that the question?
Yeah, or possibly even getting an internship at the place where you've done your long look placement.
Yeah. Unfortunately, the answer to that is no.
Okay.
And that's because internship is centrally controlled and it's a ballot system. And that's currently, and I know of no, I also sit on the intern accreditation committee, and I know of no plans to change that preferencing system. Yeah, so you would have equal chance, luck of the draw for internship.
Okay, good. That's good to know.
Yeah.
Thanks.
That said, it's usually not as competitive anyway, unfortunately, to get onto regional internship programs. So if you wanted to go, you're probably more likely to get there than to preference the Royal first.
Yeah. Okay. Thanks.
Yeah. So while we've still got, I'm just mindful of all of the individual sites' time. Are there any specific site questions for any of the specific sites who might be online that we can answer? So Gympie, Kingaroy, Stanthorpe, Warwick. So I'll take that as a no. So I'm happy if any of the educators from the sites wanted to drop off. You're most welcome to, unless you've got some other things to add before you do. Are there any other general questions for me if you want to ask them from the students? Julia, I think you've raised your hand.
No, sorry. Just clicking buttons.
That's okay.
Just one thing. My email address, it's a.cook with an E, C-O-O-K-E, @qrme.org.au. if anyone has any questions.
This is Sarah again. I know this will all come out sooner or later. We're just wondering as a group if the numbers on the QRME website are current, as they don't quite add up to 25, and they're slightly different to the ones in the talk. Just for our collective understanding.
The ones in the talk, yep. So the numbers presented in my talk, to my knowledge, are correct. Thank you for the feedback about the QRME website, and I'll go back and ensure that those numbers are correct on the website for your knowledge.
Thank you.
Yeah. All right, so any other questions, general or otherwise? Excellent. So one of the students in the chat alluded to that there is a student information session on tonight. I'll be presenting at the same session similar information along with all the other sites for third year. And hopefully there'll be some presentation on the preferencing process and how that will work for next year. If you have any further questions that you think of in the meantime, I'm happy to take questions tonight. Where Anne and myself are also happy to take questions via email, and we can, if we don't know, then we can direct those, direct the questions to the appropriate areas. All right, we might close it there. Thank you for attending.
Thanks,
so much, Brendan. And everyone else too.
Thank you.